Otex laundry system, removal of C. diff spores in the laundry, and again another hygiene monitoring system. And a recent recommendation, well, an old recommendation, one that's recently got a license for use in the UK, is a chlorhexidine gluconate cloth for body washing prior to surgery. The results are published on the DH website, and at the beginning of the results you'll get a little bit of information explaining the evidence behind the product. In the middle, it'll be the evaluation within the Showcase Hospital and how that occurred. So it's looking at who do you need to speak to within the trust to really get people on board. Who are the stakeholders? How do you manage this as a process of adoption of a new technology? And at the back, there's a sample business case. So that if you feel it's an issue that you have locally, if you feel that this technology could help, there's a business case that breaks down how you might want to take this purchase further. So either an evaluation and how you put that together, or a full adoption within the trust and how you could put that to the required people within your organisation. The local technology reviews are each of the Showcase hospitals has a local research interest, and so a number of these are brought to us from the Showcase leads, and we'll support them if it's felt that this may have a future. So we've looked at a number of things. Look at ultrasonic as an aid to cleaning. So large ultrasonic tanks and cleaning, removal of the dirt. Not necessarily disinfection, but efficient removal of dirt. Rapid screening for C. diff compared to conventional screening. There's some evaluations going on in Manchester at the moment. We're looking at IT systems to give a broader dashboard for the matrons and the nurses at the front line to see where the issue is and how they deal with it. Sterile mat for use for wound dressing, so some simple concepts but quite effective. Hand hygiene awareness campaigns, and then a system which uses cameras to measure hand hygiene technique. So not talking about have you appropriately washed your hands at the right time, but looking at when you wash your hands, are you doing it properly? This is the ultrasonic, so this is an example of the underside of an overbed table prior to use, and you can see it's reasonably grimy there. And then after use, it's quite efficiently removed all of the soiling. Now, that has two aspects. It obviously has a potential infection control aspect that any disinfectant that you use on an object such as this, you've removed a lot of the soiling, so the disinfectant should have a better chance of being effective. But also, appearance and cleanliness within the hospital is equally as important. I've got a video here of the hand wash compliance. So if we can play the video, what it's looking at is when you're washing your hands under a sink, it's looking at whether you hit every single pose within the WHO guidelines correctly. And that's looking at really, yes, you may think you're washing your hands properly and appropriately, but to what extent? If you're washing them every time you should do, but actually the efficacy of that wash is not high, what is the value of that? So here you have the camera's looking at the hand, and every time this pose is struck, the camera registers that pose, and then the light will go green. And here you go, and then it'll go green, and when you strike the other pose here, it'll go green. It's very useful for a training environment as well as an audit, and it helps people in terms of, do they understand if they've actually hit all the poses, and it'll hold you on a pose until give you about 10 seconds on a pose until you hit it. So it's an opportunity for some learning there. Everyone needs some feedback now and again. The other work that we were looking at was targeting cleaning. So there was looking at microfiber and whether how well microfiber works, how many times you wash it, whether the efficacy continues or whether it decreases. And actually, surprisingly, the more you wash microfiber, the better it gets. Maybe not surprisingly if the fibers start to open up, and then it can take some more of the bacteria. That's submitted for publication. It should be published fairly shortly. Looking at disinfectants used in the NHS, the efficacy against C. difficile spores, and some of the results that we've found are not dissimilar to what's been presented earlier. So we're just going back over those, and that will be presented fairly shortly as well. Looking at high-risk areas, how bacteria move around the ward. So when you have when you find isolates in certain areas but not in others, how do they get across there, and what's really going on with the movement of patients and microorganisms. And then looking at why people don't wash their hands before and after patient contact, and really trying to focus in on some of the psychology behind that. The Smart Ideas process I talked about earlier was talking to the NHS staff and generating ideas and problems, and then trying to prioritise some of those for further development. We've developed these products, and now they're with NHS supply chain, undergoing some evaluation and some tendering for construction. This is the first one. One of the main issues that we found were people were talking about, we haven't got enough side rooms, we haven't got enough capacity to house patients that need maybe not full isolation, but need put in a side room. So this was developed to try and provide a solution to that. It includes a hand wash facility and a commode, which instead of being waterless in the extent here, it bags what's produced, heat seals it off, and leaves it in little packages at the bottom for you. So a much nicer way of handling that event. That's been published. It's in this month's Journal of Hospital Infection, and that was looking at the ward assessment of that, bringing source isolation to the patient. Further evaluation will be underway shortly. This is a video I was talking about looking at hand hygiene compliance and the appropriateness of hand hygiene compliance. So if we can play this one, and I'll briefly explain what's going on. This is looking, instead of looking at how well you're actually washing your hands, this is looking at whether you're appropriately doing it. Now, some people might have seen locational tracking, where you could be in the general vicinity of the bed area and it'll tell you to wash your hands.
Health worker White has touched alcohol dispenser 3.
This gentleman's got a monitor on him, and there's a monitor on each of these beds.
Health worker White. Wash validated.
His hands.
Health worker White has touched patient zone 2.
Just touched the patient. The patient's touching the bed. He hasn't got anything on him. It knows
Health worker White has touched alcohol dispenser 3.
It knows that he's then got to wash his hands after he's touched the patient, and it freezes. Right. What happens is the sensor will react to the alcohol gel, tell you you've gelled your hands, but it also knows. So then he can go back and touch this bed, and it'll know he's gone to a different patient zone. The sensor will know he's touched the bed. They also know that he should now wash his hands. If he goes from that bed to that bed or that patient without touching his hands, it can give him feedback. It can record it, and it'll say that's an inappropriate and a breach of hand wash. Again, can be used for training, but it's a very interesting way of monitoring hand hygiene compliance. I'll go on from that because it looks like it's frozen. Design bugs out. You might have heard of design bugs out. It was looking at, instead of having the equipment that we've had in the wards for probably hundreds of years, let's actually look at some of the furniture and equipment around the ward and make it more cleanable. It's been designed for function, but the function is also the cleanability of a product. So a number of products were designed and they have been manufactured. Patient chair, a cleanable commode, a bedside locker, and a porter's chair. So products such as a commode, which has a direct link to infection control here. Let's strip away the amount of parts that you've got on the commode. Let's reduce the cleaning time, and really let's make a job a lot simpler for people at the front line, and let's make the job of how do I know I've cleaned this properly a lot simpler. So these are currently in the showcase hospitals, and evaluations are underway. There's some of the other products that were looked at. Support to innovators. So this is Smart Solutions. This is trying to pick out companies which have useful products but maybe not quite there yet in terms of the evidence, and trying to support them in generating that evidence. And here's a number of products that were taken forward. And you might hear about some of these later. These are product surgeries which I talked about earlier, which allow industry or the NHS to come in and talk about the problem or talk about the solution to HCAIs that they feel is technologically based and product based. And we can have a chat about that. We've had, well, this is 300 is probably a bit low at the moment. We've had a number of product surgeries and speaking to industry. If you want further information, there's the websites, and feel free to come and speak to me afterwards. Thank you.